Welcome to Medical Spa Insider. I'm Kathy Christensen, President and CSO of MSpa, and I'm happy to welcome you to this very special podcast featuring 4 leaders in the medical spa industry who are also featured speakers at the upcoming Medical Spa Show 2025. This week, we are so pleased to chat with Medical Spa Show speakers Dr. K. Durairaj, Beauty by Dr. K, Leslie Fletcher, MPBC, InjectAbility, Sahar Saghezchi, LPN, Cupertino Facial Esthetics, Grace McLaurin, DMSc, PAC, Vitality Anti-Aging Center, and Suzanne Munshower, RN, Beauty Marx Aesthetic MedSpa. Before we kick things off, we would love to give you the chance to see these faculty members, as well as all of our other speakers and exhibitors while enjoying the parties, networking, and fun in Vegas at MSS. As a Medical Spa Insider podcast listener, we're offering you 10% off registration. Just use the code Medical Spa Insider MSS25, all caps, Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com. Promo code expires on April 10th, 2025 at 11:59 p.m. PST. Promo code only applies to the primary registrant. It cannot be applied towards additional attendee registration and cannot be combined with any additional offers. Discount only applicable to new MSS 25 registrants. And now, without further ado, please welcome Dr. K.
Hi guys, I'm Dr. K. Durairaj. I'm a facial plastic surgeon from Los Angeles, California, and guess what? I'm excited to go to MSpa. Honestly, I go to so many meetings. This happens to be my favorite meeting of the year. There's so much energy and people are thriving at MSpa. It's at the Wynn, which is gorgeous. It's April 11th through 13th. And this year I am thrilled because I've been asked to chair and develop a biohacking beauty session. This is so innovative and special because now you can come to MSpa and learn about new techniques to bring into your practice, like IV drips and peptides and exosomes and polynucleotides and all of the things that are going to next level your practice. This is what your patients want. I've been in the business of aesthetics for the last 20 years, since the year 2000, so maybe 24 years. And it's been a beautiful journey. I started when there was very little known about aesthetics and nobody was teaching online courses. Nobody was teaching how to do things. You really had to learn your own techniques and read the basic science literature. And because of that, I developed something I'm very proud of, which is my online course for Injectors. It's called Modern Aesthetic Theory and Artistry. We taught in person at big seminars the first few years, and then we kind of motivated ourselves to become online after COVID. And it's been such a great journey. We have injectors from all over the world. They're learning everything from beginner Botox to very advanced techniques like liquid rhino, using Sculptra, Radius, contouring cheeks and jawlines and buttocks. And now we're teaching polynucleotides, exosomes, threads, all the next level things. So I've been so proud of being able to develop that as a platform for people all around the world to learn aesthetics. You don't realize, but in other countries and other parts of the US, people are very competitive and secretive and protective, and they don't want to share their techniques. But I wanted to democratize beauty and learning about aesthetics for all providers. I really feel like we need to next level what we do. I got tired of seeing bad results on patients' faces and having to reverse and correct things. And I was getting so many questions on my social media, Instagram platforms at Beauty by Dr. K. I'd get questions all the time. What size needle? What kind of gloves? How do you do marking for this? What product do you prefer for that? So that kind of innovated and spurred the decision for me to just teach, because the more I answered those questions, the more I realized there was such a demand. So I've been really proud of my research team. Together we put together new modules usually every quarter. And it's truly a passion project. I give out a lot of free educational content on our social media pages. People can watch videos of how I do things, but also teaching through my podcast, which is on iTunes and Spotify. And that's a place where we have really in-depth discussions. The podcast is called Beauty Bites with Dr. K, Secrets of a Plastic Surgeon. And this is where I interview people who are really doing important scientific things in aesthetics, and they're changing and bringing new developments to our field. So I love this long 1-hour conversation, really understanding the new technologies and things that are coming into aesthetics. And sometimes it's fun and trendy. A lot of times it's scientific. All the time it's interesting. It's going to teach people how to really understand anti-aging and the field that we're in. And this year I'm really proud to introduce the concept of biohacking beauty. And this is the idea of cellular health and wellness and kind of doing things to innovate how we age, how to change longevity. So we're not just thinking about external beauty, but truly like the real beauty comes from within. When we provide our body with the building blocks, the peptides, the micronutrients, the amino acids, all the things that create brand new collagen, and really creates firm, strong, resilient, beautiful skin. I want people to feel vibrant, healthy, and sexy at every age. So this kind of quest to biohack beauty, I brought it into the office, and I want to teach it at this year's AmSpa. Our biohacking beauty session is going to really draw people in. In our own office, we're doing IV drips, we're doing peptide therapies, we are trying to get people into hormone therapy and replacement, and then also just really treating the skin on multiple levels. So I want people to not only do injectables to build volume, neocollagenesis needs to happen with collagen stimulators, but superficial skin treatments with skin boosters, polynucleotides and peptides, that is kind of the next level of what we'll do in aesthetics. So that's kind of what I am most proud of, is developing modern aesthetic theory and artistry, having a podcast and being like really willing to share information with the aesthetics world. I hope people will always find me and my platform to be a resource to reach out to if they have any questions or want help. And I constantly want to push the boundary of what we do in aesthetics. Okay, let's talk about my biggest business failures or practice failures. And this is important to do every year, to sit down and think about, like, where did we go wrong? What did we do right? And I think if you're not finding failures, it means maybe you're not pushing yourself hard enough. So I do tend to push myself. I'm kind of like all in. I will go like an Energizer bunny, and then my battery will just die and I'll do nothing. So when I'm in the all in phase, I have a lot of ADHD and I think of a gazillion ideas, and I feel like I sometimes will start down many different channels, and then some of them will peter out, and then I'll figure out which things I really want to do, and hopefully those will dive deep and far. And I think this year I've had a few of those ideas. I spent a long time looking at a couple projects to bring biohacking into the office, and I'm really happy that that is working. It's definitely slower than I thought it would be. There's so much to teach patients out there about longevity and the beauty space and peptides, and I realize how much there is not enough scientific information out there, so I'm really diving deep into that this year. I think when maybe some of my bigger failures have been perhaps the idea that I never really cloned myself. I've tried to bring on nurse practitioners and hire people to have multiple locations. That was an idea, to have several locations, one in Beverly Hills, one in Pasadena, one in Valencia, and to hire people to run all those locations. And for me, that was not a good decision because it spread me very thin, and it made me realize that I really pay attention to detail and I want to be involved in every step of the patient process. It was very hard to let go of control. And so I felt like that overexpansion was a kind of a failure, because it was me trying to do what everyone else thinks is successful and popular, like get bigger, expand, and do more, and be more, and multiply yourself. And like, I should not have tried to follow other people's goals, because I know in my heart I want something more bespoke and personalized and smaller and more luxurious. And so I finally realized that it takes a little bit of failure to stretch too far and realize, like, what am I doing? This is not making me happy. So I can still see patients in Beverly Hills if I want. I share space with a friend, but I don't do that. I don't push myself and don't stretch myself too thin. I think I would love to clone myself and have more providers in my location. I'd love to have I do have some really experienced and wonderful nurse practitioners here. So that's what I'm going to do differently this year. Instead of trying to be more for everyone else, I'm going to think about what I want to do for myself. And that, it turns out, that is to stay very small, bespoke, super specialized, super luxurious and high-end for patients who want that. So as you think about your career and your trajectory, it's so important to realize that when you do those stretches, you will figure out where you're failing, where things are not working, and that's where you can rein it in and redirect yourself. When you build your brand, don't build it all on you. Build it on your business, so that if you're not there, if I'm out of town, I'm on vacation, I'm at a lecture, I still want patients to come in to see the practice. So those are some things I really feel like were good learning lessons for me, and hopefully you guys also will be able to think about that as you develop yourselves into full-fledged businesses and practices and individuals. It's really important to just like cut out the weeds of what everyone else is telling you to do and see what your own heart wants. I want to teach you guys how to biohack beauty, and I want attendees to walk away with the ability to bring all of this into their practices. It's no longer just a Botox and filler world. We truly are at the cusp of regenerative aesthetics, neocollagenesis, growing new collagen, teaching the body how to heal. This is biohacking beauty. So I hope you'll join me at AmSpa this year. Don't forget to check it out, April 11th through 13th at the Wynn. Sign up now and let's biohack our beauty.
Hi, my name is Leslie Fletcher. I'm a nurse practitioner and the owner of InjectAbility Institute and Clinic. I am so excited to be invited to be a speaker again at AmSpa's Medical Spa Show. I have been in the field of medical aesthetics for about 25 years, and the success that I'm most proud of as of now is I still have the only patent for a dermal filler technique in the world, Arcderma, Artistic Restoration Lift. I was the first nurse to be published in Journal of Cosmetic Dermatology on body dysmorphia, and the only nurse to be invited to Paris MCAS conference this year as a speaker on podium. My biggest business or clinical failure and lesson I've learned that I want to pass on to you is to make sure you hire slowly and do group interviews and make sure that the majority of the team agree on that new hire. With patients, consult to optimal enhancements from the first visit to avoid dissatisfaction from results later on in their treatment. I invite you to come check out our sessions, my session at the Medical Spa Show in 2025. My first class is taking place on Saturday, April 12th from 1:05, very specific, to 1:30 in the Inclusive Beauty Embracing Diversity and Equity Medical Spas track. The title of my talk is How to Navigate Body Dysmorphia as an Aesthetic Professional. And during this session, I will be covering body dysmorphia and how it affects us. So there's about 15% of our patients are going to have this. So aesthetic practitioners really need to be highly tuned in to the patient's potential or pre-existing potential, and then also escalating behaviors that we might see from these patients that would affect our treatment plan. And maybe we shouldn't do them. Maybe we should not treat them that day. I'm going to help you learn how to anticipate your patient's treatment outcome expectations to determine if the proposed treatment plan will be able to meet those expectations, or maybe you should deny them treatment that day. So I'll be revealing some results also from a 4-month pilot study where I did have these offices deliver a multi-phasic cryptic pre-screening collection tool, and it was utilized in 4 different offices in the US. And I'll give you a copy of this tool as well to use on your patients. And I'll give you also tips on how to administer this cryptic, non-threatening kind of pre-screening to see if these patients are going to be healthy enough to get treatment, or maybe even used as a deterrent for high-risk patients. And we can help you build a protocol for what to do if we do need to deny treatment for patients. And any reason, it may not be body dysmorphia, but just to kind of deliver a plan to decrease dissatisfaction for our patients. Also on Sunday from 9 to 9:25, I'm going to be in the What Would You Do? Clinician versus clinician track. So it's kind of a contest. I have the very fun task of getting to prescribe 100 units of Botox in any area that I think would benefit or be impactful for a particular patient. I'm also going to be paired with another top injector colleague who's going to make their own plan, their own prescription for their patient. And you're going to get to vote on which plan you think would be best for the patient. And so it's kind of a contest. We'll see how I do. Finally, later that same morning from 10:45 to 11:45, I'm going to be part of a panel, the Conformity and Consumerism panel. When do we decline the dollar to preserve ethical aesthetics, which I think is so important and goes along really nicely with my dysmorphic talk. So I will see you. I'm bringing my entire team at the Medical Spa Show 2025. We're going to have a booth, and I will see you there. I think it's going to be a great weekend, and bring your team and enjoy learning.
My name is Sahar Saghezchi, and I'm the founder of Cupertino Facial Esthetics MedSpa. I have been in medical aesthetics for over 18 years, and the business or clinical success that I am most proud of is the relationships that have been established and built with patients at Cupertino Aesthetics. Being honest, providing education, always ensuring that your patient's safety and care comes first creates a level of trust that is really hard to have when there is so much competition. I deeply value collaboration and continued education, having such a wonderful relationship with so many of my colleagues in the industry, and really getting together with everybody quarterly is really one of my biggest clinical successes that I have established and will continue to do. My biggest business or clinical failure and the lesson I learned from it, I would honestly say that being in business comes with a lot of redirection and lessons, a lot of trial and error and clarity. Failure is a part of the risks that we take, and if you've been doing something for long enough, you are bound to have made mistakes. One of mine would be saying yes to too many things, taking on too much, and knowing when to say no is one of the most valuable things that I have learned in business. I invite you to come check out my session at the Med Spa Show 2025. My class is taking place on Saturday, April 12th at 2:15 in the Inclusive Beauty, Embracing Diversity and Equity in Medical Spas track. The title of my talk is Identifying Red Flag Patients Who Can Significantly Impact Your Practice if Not Carefully Managed. Whether it's the clinic hoppers chasing unrealistic promises, those with unattainable expectations, or the ones who attempt to take over your consultation and dictate their own treatment plan. In this session, I'm going to discuss how to recognize these red flag patients early in the consultation process, and more importantly, how to take back the control in your consult. By the end of this talk, you will feel more confident in navigating these challenging scenarios and turning potential obstacles into opportunities for growth, patient education, and practice protection. See you in Vegas.
Hi everybody, I'm Grace McLaurin. I'm a physician assistant from Hickory, North Carolina, and I'm the owner of Vitality Anti-Aging Center and Medical Spa. I'm excited to be speaking at AmSpa's Medical Spa Show this year. This is always an amazing show, and I'm honored and humbled to be able to speak there. I have over 24 years in the aesthetic space and have owned my business since 2006. When I think about opening my business, there's been so many highs and lows. I try to think about what are some of the things I'm most proud of. Certainly one of the things I'm most proud of is the patient loyalty that we've been able to build. And I think that's because I've built a good team, not me, but our team is a good team. And we treat patients well. Patients come in, they refer people, and literally when they talk to us about changing their lives, those are my moments of pride. When they take the time to send a card, or they put a nice review up, or I have employees that stay with me from the very beginning who've been here almost 20 years and love their job. Those are the areas that really make me happy and make me feel like I've created a successful business. When I think about some of the biggest mistakes I've made in this business, I've made so many, and they've been small and they've been large. But I think one of the biggest things that we do as business owners is sometimes we get desperate to hire people, and we hire people that aren't right for the position. So I do a lot of work with personality testing and stuff, and we try to put the people in the right position for their personality. I think when you see somebody in the wrong position, they immediately become unhappy with their job, and they can literally become what I call a tumor in the office. And I had a really bad experience with an employee like that. And the day she left, she ended up taking 4 employees with her. And that's just a really disappointing thing and something we really avoid. So I really try hard to make sure I have the right bottom and the right seat. I'm really excited to be speaking in the Bridging the Divide conversations. It's the track that's a panel on controversial issues, and I'm going to be talking about on the panel when it's right to say no, like self-injecting, when patients are on a budget, when patients are asking for things that we're not comfortable doing. And I think that this is something that's really important. I say no. I tell people when I'm training as many times as I say yes. And so I think we really have to get comfortable saying no to ourselves and to others. And I think this is a really important topic, and I hope that I'll see you there. It's from 9 to 10:30, and I think that's on Sunday, if I'm not mistaken. Then following right after that, from 10:45 to 11:15, we're going to do a what would you do kind of clinical face-off. I'm going to be with the amazing Kim Burke, and we're going to be talking about patients who are trying to have full facial balancing and harmony on a budget. And we're each going to come up with a plan, and then you as the audience, which is really scary to me, get to vote on which plan you like. It doesn't mean that either plan is wrong, it's just which one seems like it would work best for you and you're the most comfortable. I think it's going to be an opportunity for all of us to learn, including me. I'm looking so forward to watching Kim and hearing what her ideas are in dealing with a patient like this, and I really look forward to seeing you. So we'll see you in April, and just come up and say hi. Have a great day.
Hi, my name is Suzanne Munshower. I'm a registered nurse and owner of Beauty Marx MedSpa in Doylestown, PA. Yes. I've been in the medical aesthetics business for 16 years. I started Beauty Marx in 2008. The thing I'm most proud of is just building such a great family-like community of my employees and my patients that have been with us for so many years, and giving the people confidence. It's just such a great field because you get to make people happy and feel good about themselves, and I'm just so proud of the team and the patients that we've built over the years. I think the biggest lesson learned for me is I've been so proud of mentoring new injectors, and I love to teach. It's one of my biggest joys that I get in this industry. And I'm so blessed to be able to teach for so many different brands, Allergan, Galderma, Revance. One thing I did learn was when something new comes to the market, like Quo, I was just so excited to be able to tackle cellulite. But what I learned was not to just rely on the studies and to not teach on something until it's been in the marketplace long enough for me to really get real experience on results of my own patients before I start teaching others. I invite you to come check out my session at the Medical Spa Show 2025. My class is taking place on Friday, April 11th at 5 to 5:25 p.m. in the Clinical Innovations 1 Bridging Theory and Practice track. The title of my talk is Optimizing Outcomes with Injectable HA Microdroplets and Skin Boosters. During this session, I'm going to teach you how I use this every day in my practice to address things we've never really been able to address in the past until these products hit the market, including fine lines, pore size, hyperpigmentation, redness of the skin, and really being able to treat the dermal layer, as opposed to how in the past we've only really been able to treat the fat pad atrophy of the face and the bone loss. This has now given us something amazing we can do to improve the quality of the skin almost instantaneously. I look forward to seeing you all there at the Medical Spa Show 2025.
Don't miss Medical Spa Show 2025, April 10th through the 13th at the beautiful Wynn in Vegas. Use code Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com. See you there.